was Suchita Kalele, a lady of big dreams and great achievements. She pursued a Bachelor of Engineering in Electronics and Telecommunication from Vidyavardhini College of Engineering and Technology in 2007. She graduated from Symbiosis International University in 2011 with a degree of Masters of Business Administration, Human Resources. She started her career as a software developer and tester in Tata Consultancy Services and have worked there for 1.5 years. She later joined Philips in 2011 as a management trainee. She played the role of Deputy Manager in Leadership, Talent Management, and assumed the additional responsibility of Diversity Council member of Philips India 2012. Her other special experiences include designing incentive program and developing and launching employee share purchase plan at Philips India. Currently, she is a HR business partner for customer service function, and her achievements include Best Individual Contributor at Philips Electronics India Limited in 2013, Best Regional HR Manager at Philips India Limited January 2015. She is also a recipient of JRD Tata Scholarship in 2005 and 2006. She's best in taking ownership category for driving end-to-end learning interviews such as development centers, leadership programs, learning curriculum, talent management from Philips India Limited in January 2014. She is an apt example of the quote, "A journey of 100 miles starts with a single step." Welcome to Biomedical 16, ma'am. Moving on, I request you to come to the stage.
Thank you so much for inviting me for this event.
Can you hear me now?
Thank you so much, first of all, for inviting me for this event. I think it's a pleasure to come and interact with all of you. There's a lot of energy that we get from the young guys. So very, very good morning to all of you. Breakfast? You didn't have your breakfast? Good morning.
Good morning.
Louder. I think only one person had his breakfast this morning. Once more? One last time? Loudly. Okay. So I think now we are ready and we are all awake to know what is going to happen in the next couple of minutes. So I requested Vinita to give 15-20 minutes before we start the mock interview, because it's important for us to understand what the industry is all about, what the different functions are all about. Yeah. So before we get into the healthcare industry, I'm sure all of you know that India is a growing economy, right? There's a lot of scope, there's a lot of opportunities for us in India, with a large consumer base, with a huge opportunity in the B2B space. But India has its own set of challenges, right? We know there's a lot of corruption in India, there are a lot of political, issues which crop up at times, right? There are issues around, we know that there's a lot of potential, but how do you really go about unlocking the potential? When it comes to India, the customer is very price sensitive, right? We really face this challenge around profitability. How do we manage profitable sales and business in India, right? With the customs duty increasing, with the value of rupee depreciating, the challenges have been increasing and will continue increasing in the couple of years. Right, so these are the dynamics, and though we know there are a lot of opportunities, we also know there are a lot of challenges. So how do we really unlock the potential of India? This is a challenge for us, for all of us, and I'm sure all of us would agree with that, right? So from a healthcare perspective, I just thought maybe I'll just share few thoughts and few inputs that I had with all of you. Yeah, so this is the current healthcare scenario in India. We have a market size of around 100 odd US billion. The medical tourism is pegged at around USD 3 billion, and we have a lot of scope in emerging technologies like medical e-commerce, stem cells, genetic engineering. So these are the areas which are in today, and we all know that there's a lot of work in progress going on in these areas, right? However, what is really stopping us is the focus of government on health care is a little lower. So in terms of the amount of money that the government invests, we see a lot of private players in India versus public-owned hospitals that we see in developed countries like US. Right? If you look at the affordability piece, the GDP per capita in India is very low if you compare it with China and US economies, right? So US is like 33 times of what India is, which is a huge number. And out-of-pocket spend is highest in India. So more than 60% of the spendings happen from our pocket, from the individual's pocket. Yeah? Which again, puts a lot of pressure on the on the talents, which puts a lot of pressure on the people, and that's why you see a lot of affordability concerns. Given that we have a lot of people in the rural sector as compared to the urban sector, this further is a big issue. And hence, India is termed to be one of the lowest priced healthcare markets in the world. Yeah, so these are some constraints. However, if you look at what is expected in the healthcare industry, there are huge opportunities. Okay, the market is going to increase further to $280 billion. Yeah, by 2020, the medical tourism is going to double up. We'll see significant development in the areas of predictive analysis, electronic reporting, and the stem cell technology that is just emerging, or we are not yet yet there in terms of the development. I think that is something picking up a lot of space, and this will really improve the healthcare delivery in the India sector. Yeah, so these are a couple of points, and what are the trends that will share the future landscape? How will this change happen is, we know there is an increasing demand. The lifestyle changes, the chronic disorders which are coming up will obviously increase the patient flow, right? The increasing income is basically the amount of knowledge that all of us have today versus what we had in the past and what we'll have in the future. It's going to be immense, right? It will really help us to be more active, more knowledgeable, to take proactive space, which will again increase the inflow of patients, right? There's going to be increased coverage in terms of insurance. So with more knowledge, with more awareness, we'll see a lot of money coming to the insurance sectors. And the growing per capita healthcare spend will increase along with the increasing income. So from a demand side, there is going to be a lot of pull. It's going to be a pull-driven market. It's going to be a pull-driven sector. From a supply side, we see that it's going to be expand primarily in tier 1 as well as tier 2, tier 3 cities, right? Nursing homes are going to make its dominant place in tier 2, tier 3 cities. Private equity firms are going to invest substantially in the diagnostic space, in the healthcare delivery space. We have already seen the exponential surge, and it is going to further increase, which basically means there is going to be a lot of supply from the healthcare industry perspective. However, which means with the increasing patient load, with the increasing hospitals being set up, there will be a huge demand from the talent perspective. Yeah, and that is going to be a gap. That's what we foresee, which means that the onus is on all of you to ensure that you really pull up your capabilities and make yourself ready, because you are going to be the future of the healthcare industry, given that you are from the biomedical background. Yeah, from the ecosystem, we expect the government to increase its spending, and PPP will become the top priority. So what is PPP? PPP is nothing but public-private partnership, where government will join hands with the private sector whenever there is an establishment being set up. So this kind of joining of hands will really help in this kind of booming sector. Yeah, and it will create affordable care models. The minute government gets involved, a lot of affordability will get generated in the process. Yeah, so these are a couple of trends which will involve. Now, just a question to all of you. So these are just a brief snapshot of where the industry is going. What is the role that you will be playing, or what according to you would be there in it for you? Any suggestions, anything that comes to your mind? So these are I think a lot of dignitaries yesterday have already spoken about the industry and how it is expanding. How do you think will it impact you? Number of opportunities will increase, yes. What else? How does this impact you? So you are the talent workforce, right? You are the people who are going to take this forward, and whatever is the future is going to be from all of you. What do you think? More diversity? Okay, I'm happy to get that answer. Okay. What else? Anyone else? How does this impact you? How does this translate into your careers? Anyone else? Yeah. So I think both of them mentioned it very correctly that more opportunities are going to be created, and if the organizations have to be successful, if the industry has to be successful, we really need to have great people in place, because great vision without great people is just impossible. Yeah, we cannot implement it. And hence the onus is now going to get translated on all of you to make this successful. Yeah. So, and hence I just thought of sharing what are the few basic things that you have to keep in mind before you even start working or get into the organization. So this is a small model that I have developed, which is basically which speaks about you need to be equipped beforehand. So gone are the days when you used to get into the job, get trained, and then really start contributing. We expect when we come to the campus the students to be prepared, at least in terms of their thought process. They should be clear on what is it that they want to achieve, what is it that they want to do, and how they will be doing it. And hence, this word is basically nothing but it speaks about how are you going to attack the base. So how do you really build basics? So you need to be very clear when you get into the workforce that for you the customer is going to be the king. You have to be really very sure that when you get into the workforce, you get in that customer insights. Yeah. So without knowing, so a lot of customers may not be able to articulate their needs. Your responsibility will be to understand their latent needs, whichever function you are. Yeah, whether it's sales, service, application, projects, whichever function you are, you have to understand what are the customer insights. Yeah, you really dirty your hands and understand what is happening in the field on the ground. Yeah, you have to drive innovation. So let me give you an example what innovation means. Okay, I was coming with Vishal in the cab, and he mentioned that people are really very gung-ho about getting into R&D with the white coats wearing and doing those experiments. So while all that is true, you need to understand that innovation doesn't mean trademarks and patents alone. Innovation means how do you bring your creativity alive to make a difference to the company and to the customer. From a service perspective, if assume an engineer who has to go to the customer end, okay, the machine is down from 2 days, and he has to ensure that the machine is up and running in next 2 to 3 hours because it's an escalated case. Yeah. With the innovation mindset, you will be able to come up with solutions which are different than the ones stated in the manual. You will be able to think differently. You will be able to add value, and that is innovation for us. Innovation is not just the trademarks and patents. Innovation should be in your day-to-day life, thinking differently, adding value differently. Yeah. And the third piece is around adapting continuously. Okay, so this is an ever-changing, complex world. So it is all the more important for all of you to ensure that you are flexible with your customers, with your organization. You will be interacting with different stakeholders, you have to influence different people, and you have to adapt and be flexible in your entire approach. Yeah, so these are things which are going to be the basic building blocks for you as you enter your frontline roles. In addition to that, there are certain people capabilities that we expect you to display, such as divergent thinking. You need to be really out of box with your solutions. Predictive analysis. So again, for example, on predictive analysis, assume a situation where there is a cath lab being installed, and you are remotely monitoring the error logs. Okay, and you're able to tell the customers 10 days in advance that hey, there is some fault which is going to crop up in your machine, and the machine will be down. Okay. So can I come for a preventive maintenance? Can I come for a call and ensure that the machine, doesn't get into a failure mode? That is known as being able to predict the problem even before it arrives, and that is innovation. That is different thinking. Yeah. So all these things are going to be very critical as you get into the medical industry. Risk taking ability, obviously, you should be able to take certain amount of calculated risks. Because you are the front end team for us with the customer. You are the single point of contact with the customer. And obviously technically we expect the talent to be updated on all the technical platforms, being agile to really keep learning continuously. Systems and solutions thinking. So earlier we used to say, for example, in sales, your responsibility is to sell one ultrasound or say one patient monitor. Now we say, hey, can we look at an end-to-end solution? How do we really help the customer in building up the entire setup, right from the infrastructure to equipment side? Yeah, so how do we really understand the latent needs and then look solution rather than selling a particular item. Yeah, we are in a B2B industry. It's all relationship driven. And rapid prototyping. So doing some small experiments and then sharing the best practices, starting and implementing it rather than waiting for the entire new setup to be established. Okay, we need to have a more solution-oriented approach rather than just rather than just saying that this is the problem, this is the issue, what do we do about it? So more than issue, it should be a solutions-oriented approach. Yeah. And these are the basics that you need to keep in mind before you, in order to become a successful corporate leader. Yeah, very simple ones, but I thought it is important for me to just share it with you. Yeah, because if you fail in any one of these, that will be a big derailer in your career. So in terms of those, it's important that when you get into the organization, you observe, you learn, you understand, you question always. Be critical, but on a positive note. Yeah, you have to be able to change your style. That's something we mentioned in our earlier slide as well. Be adaptable, be more flexible in your approach. And obviously, by no means you should get involved in any kind of unethical practices. Value system is something that will drive you and take you long in the career. In terms of derailers, never have this I know it all attitude. So we have seen examples where the engineers join us in 6 months training period, they get accustomed to the culture, etc. And then they pick up a modality, stay in a modality for 1 odd years, and then they think, oh my god, I have learned everything in a particular, say, ultrasound machine, which is really very difficult. Let me be very honest, the number of products, the range that you have in a particular modality is going to be huge. So to say that I know it all, you are limiting your own learning. You need to have a very high learning appetite. You need to be in a constant, there should be a constant urge to keep learning newer things in life. So that is something very important, I feel. And the second one, which is again very important, is this is not my problem, it lies somewhere else. When you join any organization, you have to ensure that you are representing the organization. You cannot pass the buck to someone else. So if I am the front-end engineer and if I am escalating the case to my senior, the point of contact still remains me. I cannot go and tell the customer that it's not my problem, it's with my senior. Right? So you need to develop that mindset upfront. You cannot, you have to take ownership. You have to show that you will be the front-end to the customer to solve the problem. Yeah? Not adapting to the culture, obviously that you will not be able to survive for a long time. Loose stock, cribbing are some of the biggest derailers again. So you are very young, very prone to start cribbing, this is not going well, this is not happening right, etc. Loose stock, speaking about someone, being judgmental about people. The minute you enter into all these things, your career is somewhere coming to a dead end. The minute you start indulging yourself in all these things. So just be aware of these things and ensure that you don't get into any of these traps. Yeah. So this was broadly about what are our expectations when we look at people during campus interviews, on what are the capabilities and what are the behaviors that we expect. Yeah. Now, as we will be getting into mock interview, I thought it will be a good idea to just share a perspective on what are the major functions in medical equipment industry. So I come from a Philips background, so Philips and competitors may probably have similar structure in place. So the first function is the sales function. So what is sales? So what is sales function? What does a sales guy do? What is the responsibility of a sales guy?
Does it try to convince this customer
Huh?
to sell his product and promote his product?
Absolutely. So I think sales is a guy who is the first point of contact for the customer, who interacts with the customer and, as Vinita rightly mentioned, influences, understands his needs and provides him the right solution. Please remember, it should always be a win-win situation for the company as well as the customer. Yeah, you should be able to give him what he needs and also which benefits the organization. So this is the person who drives business, who brings in money to the organization. Yeah, who will ensure that the orders are taken from the customer, revenues are collected from the customer, and drives the top line, that is the sales, as well as the bottom line, that is the profitability of the organization. Yeah. So everything in terms of money is done by this function. Then comes the application specialist. We also have someone from Siemens with 3 years of experience in application specialist. But what is your view? I know Vinita knows it, but anyone else, any idea about what application specialist is all about? Any clue, any wide idea? What is their role? I've listed a couple of points for your reference. Demos.
What idea about the problem? What are the possibilities? Is the technical term of the machine.
Okay, so this is a clinical team, okay, which will be involved in the pre-sales, and you've partially covered it. So this team, along with the sales, especially modalities like ultrasound, are responsible for driving the order intake. So they will be supporting along with, so they will collaborate with the sales function to make the deal happen. So from the clinical perspective, they help the customer understand on what are the advantages, what are the uses, what is the USP of the machine, what is the value that the machine would be adding. Yes, that is the role of an application specialist. He may not know about the mechanical features about the machine, but more so from a clinical perspective. Yeah? What is the role of operations? Or else I'll pick out. What is the role of operations in any company? Half of the things are mentioned there. I know you may not be completely aware of it, but any wild guesses, anything that comes to your mind?
I'm guessing that they manufacture. They run the manufacturing part of the equipment, and the installations is already mentioned.
Okay. I think there's one more answer in the right.
Yeah, once the hospital is ready to purchase the equipment, we have to give them equipment. So we have to get it from the warehouse and we have to install the machine. So if it is MRI, we have to fill the helium like that. We have lots of procedure in that. So someone should be there to do all these procedures.
Right. So what you mentioned was more on the factory manufacturing perspective, right? So there are factories where the manufacturing of the products is done, right? The operations responsible for something that you mentioned of ensuring the warehouses are stock is there in the warehouses, forecasting is done, part movement is done, the equipment movement is done. That is the role of the supply chain and operations team. In addition to that, we have something called as projects team. So where again we have people like you, we have hired engineers from SRM 2 years ago, if I'm not wrong, and one of your alumni is in the projects team now, and hence I mentioned this function as well, where the team is responsible for installations along with the customer service, along with the sales team. They are responsible to ensure that when an MRI is sold, it's not about just selling the MRI, it is about setting up the entire room, right? So the projects is the one who will ensure that it is end-to-end to close and the installation is complete. So that is the role of projects. Yeah? And then comes the customer service. So customer service is the technical team who gets into the nitty-gritties of the machines, who opens the machines, who knows what is happening where, who are the technical aces in the organization, who can resolve the customer issues. So once the sale is done, once the machine is installed, we have something called as AMCs, which are nothing but annual maintenance contracts. Okay, so the machine, if it is in warranty AMC, we are supposed to provide service to the customers. Right? If the machine is down, this is the team which will run, which works over weekends, which works at night to ensure that the customer's revenue doesn't get a hit. So they'll immediately rush to the customer side and ensure that the machine starts working as soon as possible. Okay, so these are the technical guys. These are the engineers who are involved in maintaining the machine. So since they are the ones who work with the customers, say for 5 years, 10 years, this team is responsible for repeat sales. If I am giving the service to the customer and it's a good service, obviously the customer would want the machines from my company. So service plays a very important role in getting the repeat business and driving customer satisfaction. So the customer service guy is the front end for the customers. Even even if it comes for repeat sales, it happens through the service team. So this is just a broad perspective on the various functions, which I thought maybe it will be good for you to know. Any questions you have on this? Any doubts you have on this? on what are the different roles, what is it that you can do. So I can speak more from the equipment industry. Yeah. And any doubts you have, because you will be maybe 1 year down the line, 3 months down the line, appearing for the interviews, and you should be clear in terms of what are the different roles or what is going to be my job when I start working with the organization. Yeah? Any questions?
There are many companies in India, actually many in India, but the manufacturing units are not much in India. What is the main reason? Is there any possibilities in the future to start something?
Yeah, so the Make in India campaign is something which is very lucrative, for which we have started. I think GE already has manufacturing sites in India. Philips per se has a site in Pune. It's a small setup where we are primarily manufacturing cath labs. But there is a scope that we are looking at in terms of Make in India campaign. However, it will take some time. It's a, it's a big, heavy equipment industry. But
Equipment in India, raw material, equipment for the raw materials, is there any difficulty? Why they are not in India?
so that's what I'm saying. So we have started slowly coming up because of the lucrative, so right now for us, importing a product is is a very costly affair. I'm sure you will be aware the customs duty which has been, increased by 7.5%, and we are paying a huge duties on every machine that we are importing. So there are a lot of options and reasons for us to manufacture in India, and we are looking at local for local products, which obviously, I'm not very sure, but whether you are aware of, but Philips has its own innovation center in Bangalore. Yeah, so we are producing local solutions. From a manufacturing point of view, we have created since 2010-11, we have launched a factory in Pune. And we started manufacturing, but it will take some time, another 4 to 5 years at least, for a full-fledged production. Yeah?
Anyone have queries?
That's it? Yeah? Thank you so much, and look forward to interacting with all of you. Leading the data. Thank you for the thought-provoking talk, ma'am. You talked through light on the current healthcare scenario in India and healthcare opportunities in future. You've also given us a lot of hope about our future in this industry. Thank you, ma'am. Moving on to the next.